Next speaker is going to be Nico Ubens from FEops. He will be with us, and check the time here, 2 minutes. So stay tuned.
Hello, good afternoon. This is Nico here. Give me a sign when I can start presenting.
Apologies there, I had to unmute myself. Can you hear me?
Yes, I hear you well.
Okay, sorry about that. Okay, Nico, so we're going to go ahead and start with his presentation. Thank you again for joining us. So go ahead when you're ready and take it away. Thank you.
I can just, it's not possible yet for sharing my screen. It's indicated you cannot start screen while the other participants is sharing.
Okay, apologies for that. Just one moment.
Yeah, no problem.
Okay, all right, Nico, everything okay now? Sorry about that.
Yeah, my slides, I think I share them if you can see them.
All right, wonderful. Yes, we can. I'll go ahead and mute myself. Yeah, okay.
And let me know when I can start.
Okay, please start. Thank you.
Okay, good afternoon, everyone. So this is Nico here, Nico Ubens from FEops. I'm in charge of the business development and happy to present you something more about the digital twinning cardiology and about the evidence, which is definitely everything. So as I mentioned, I'm in charge of the business development, so I have a less technical background. So please take it also in mind when you ask your questions. Well, with the FEops journey, would like to take you to the field of cardiology and more precisely the field of structural heart. So when I talk about structural heart, this is about the transcatheter interventions with the different heart valves, like for instance, TAVI, so the transcatheter aortic valve interventions, and for instance, also the LAAO, so the left atrial appendage occlusion. So there's a clear shift from really, you know, the open heart surgery to the minimal invasive surgery, and there's very good reasons for that. It's faster procedure, faster recovery, but nevertheless, there is good preoperative planning. There is still some complications which are happening. And that's really our objective as a FEops Heart Guide with the digital twin, providing additional insights and driving these complications down and really driving also the efficiencies for more efficient interventions, leading to better patient outcome and leading for more happy physicians. That's really our objective for FEops, and that's also what I'd like to present you here with the clinical evidence what we have. So first of all, about FEops Heart Guide. So how is this working? Well, for FEops Heart Guide, we have different workflows in structural heart. Just for instance, here we have the CE mark for LAA and our TAVI workflow. And we have also the FDA approval for our LAA workflow. So for this preoperative planning, so what are physicians doing? They uploading their CT scans with an easy drag and drop to the FEops Heart Guide cloud. So FEops Heart Guide is a cloud-based platform, so physicians don't need anything to be installed on their computer. So we will process the cases when we receive these cases, and we will notify the physicians when these are ready. At that moment, physician, he can log in back to his FEops Heart Guide account, and here a short video on what he can see then. So there's two ways of looking at results. First of all, there's a 3D viewer. And here in this 3D viewer, he will first see, and this is an example for a TAVI, first see before having the digital twin simulation here. So first inspecting the anatomy, and then we will simulate, we will apply also FEops Heart Guide predictive simulations for doing predictive simulations here, and also doing a virtual implant where we will assess the risk of conduction abnormalities and also assessing the risk of paravalvular leak. So it's not only qualitatively what you see here, but also quantitatively, and also you can see also here the numbers also in this PDF report, but both in the 3D viewer and the PDF report, physicians can also assess all these values. So I think on looking at really comparing FEops Heart Guide digital twin technology with traditional preoperative planning, I think we can say that with this device anatomy, which is FEA-based simulations, we give a much more realistic image on what physicians will be seeing when they will do the implant. And for instance, for TAVI, predicting the paravalvular leak, conduction abnormalities, but also on the measurements. So these are AI-based measurements. So in other words, these is automated measurements giving faster and improved procedure efficiencies. So as an example here for a TAVI, so these are the simulations that we have been providing for this particular case that we provide to the physician. So we don't give a recommendation here, we give different options. So we have been simulating two different sizes for this patient here of a TAVI device and two different positions. So the upper row is more assessing the conduction abnormalities, and the lower row is more assessing the PVL. So all these parameters, they have been validated and have been also assessed for making sure at which percentage there's a risk of conduction abnormalities. Like for instance, here you see this rectangle, which is the zone of interest defined by the membranum septum. And you see when there's too much contact pressure, like we see, for instance, here, and with more than 14%, because as a cutoff, there's an increased risk also for these conduction abnormalities. So a similar assessment and validation has also been done on the paravalvular leak side. So I think on a technology point, we have our technology, it has been validated. Of course, the next question, of course, is, well, is this also for clinical value? And yes, I think we see a very nice physician adoption here. So this is just at the bottom here, some testimonials from different physicians. And honestly, these are quite top key opinion leaders here, both on the US side or Canada on the left side, or from Europe. And I think we can say that we're becoming more and more a digital health player here. Not only active in Europe, but also active more and more in US and also in Asia. So getting close to 6,500 patients, more than 300 hospitals in 27 countries, and a robust clinical evidence. So physicians, they start for using it, that's important, but also one important question for us, what I mentioned at the beginning, we would like to contribute to patient safety, contribute also to patient outcome. That's why also we have been doing these clinical programs for assessing these aspects. The first clinical study that we have been doing, this is an investigative clinical study by Professor De Backer and Rikshospitalet in Copenhagen, and results have been presented a few months ago at the TCT conference, so one of the larger cardiology congresses in the United States. So this investigator-driven study by Ole De Backer is a randomized clinical study. It's a multi-center study which has been ongoing in 10 different sites. There are 200 patients included in the study, so 100 patients in the control arm and 100 patients in the FEops HeartGuide digital twin arm. So in other words, that is allowing us really making a kind of head-to-head comparison, comparing the traditional preoperative planning with the FEops HeartGuide, with the additional insights that we are providing here. Important to note here, that's really, when you look at these implanters, these are very, very experienced implanters. They have been doing hundreds and hundreds of LEA interventions. And that was the, well, to be honest, we were not so confident with the outcome of the study with these experienced LEA implanters, but nevertheless, for the contribution of a FEops HeartGuide for LEA procedures is definitely interesting to see, because FEops HeartGuide shows in this clinical study here that having a positive effect on procedure efficiency, so not only on reducing procedure time, contrast, and radiation, but also on the number of devices used per procedure. So in the control arm, there was almost 1.2 devices used per intervention. So meaning about 20% missizing, even by these experienced implanters for LEA. In the FEops HeartGuide arm, the number of devices used per procedure was 1.03. So getting very close to one device per implant. So in other words, the digital twin additional insights with FEops HeartGuide provided additional insights for the physician, leading to a better procedure efficiency and leading also to the right device size and right device position for that particular patient. The other parameter is also about procedure outcome. Important aspect, of course. So even with experienced physicians, we see that there's still not always a complete occlusion of the left atrial appendage. And leak matters. That has been demonstrated in different trials. Even small leaks can lead to complications like, for instance, stroke. So very happy to see that also FEops HeartGuide digital twin could contribute here compared to the traditional preoperative planning with a 40% more complete LEA closure without any leakage. This is for LEA, but also in TAVI, and this is a more recent study, has been presented last week at PCR London Valve, has been presented by Professor Nicolas van Miegen for assessing the effect of FEops HeartGuide in TAVI with challenging and complex anatomies. So this is a registry, prospective registry, with the objective to assess what is the effect of FEops HeartGuide for changing the heart team decision. So this is also a multi-center study in more than 70 patients. And all these physicians, first of all, they used the preoperative planning that they always use, traditional preoperative planning. They freeze a decision, they're taking note of that. And after that, they were really having access to also the FEops HeartGuide predictive simulations. And then it was assessed in which way they were really changing their mind, changing their decision when it comes to device size, when it comes to device position. And what do we see? That in more than 1/3 of the cases, these experienced physicians, they changed their mind after having access to FEops HeartGuide digital twin, after having access also to having a better understanding about the interaction between the device and the anatomy and about potential risk of conduction abnormalities. And this was also leading to favorable clinical outcomes. So you see here the rate of pacemaker and PVL, which is still happening, because understand this is about very complex anatomies. But when we compare these numbers here with literature in a similar patient population of complex anatomies, well, this is rather lower than what has been published in literature for this same type of patients. So I think what we can say here also, so that not only the technology has been proven it works, physicians like it, but also about the clinical evidence is there and really contributing to better clinical outcome and better efficiency. So I think we can definitely say evidence matters and evidence is really important. So in that regards, just want to share also the last news from yesterday evening with FEops. So we were awarded by, by EY and also by the Belgian government of the Scale Up of the Year 2022. So that was from yesterday evening. We had quite some celebration here also with the team. There were more than 1,000 people participating in that event from EY. So happy also to share that with you. So that's not only contributing to better patient safety and outcome, but also contributing to a very strong and very, nice team to work with. Thanks for your attention, and please let me know if you have any questions.
Wonderful, Nico. Thank you so much. So it looks like we don't have time for any questions. However, I do encourage our attendees to reach out to you personally for any questions via LinkedIn or the information that you've provided. So we're going to go ahead here. And
yeah, definitely happy to respond to these questions offline or LinkedIn. Please contact me. Don't hesitate.
All right, wonderful. Thank you so much here.